Schizophrenia is a serious mental disorder characterized by a range of symptoms, including delusions, hallucinations, disordered thinking and speech, and abnormal behaviors. People with schizophrenia may experience a loss of contact with reality and have difficulty distinguishing what is real from what is not. The disorder typically emerges in adolescence or early adulthood and can be chronic, with symptoms lasting throughout a person's life. Schizophrenia can be debilitating and can impact a person's ability to function in daily life, including their ability to work, socialize, and care for themselves. It is treated with a combination of medications, therapy, and support from family and community resources. There are 7 types of schizophrenia includes: paranoid schizophrenia, hebephrenic schizophrenia, catatonic schizophrenia, undifferentiated schizophrenia, residual schizophrenia, simple schizophrenia, unspecified schizophrenia. Paranoid schizophrenia is a type of schizophrenia characterized by the presence of prominent delusions and hallucinations, often involving themes of persecution or conspiracy. People with paranoid schizophrenia may believe that they are being followed, spied on, or controlled by external forces, or that they are being plotted against by others. They may also experience auditory or visual hallucinations, which can further reinforce their delusional beliefs. In addition to these positive symptoms, people with paranoid schizophrenia may also experience negative symptoms, such as emotional flatness or reduced motivation, and cognitive symptoms, such as disordered thinking or difficulty with memory and attention. Treatment for paranoid schizophrenia typically involves a combination of antipsychotic medications and therapy, such as cognitive behavioral therapy, to help individuals manage their symptoms and improve their functioning. Hebephrenic schizophrenia, also known as disorganized schizophrenia or hebephrenia, is a subtype of schizophrenia characterized by disorganized thinking and speech, flat or inappropriate affect, and disordered behavior. People with hebephrenic schizophrenia may exhibit unpredictable and bizarre behaviors, such as laughing or crying inappropriately, making nonsensical statements, or engaging in repetitive or stereotyped behaviors. Other common symptoms of hebephrenic schizophrenia include disordered thought processes, such as loose associations or tangential thinking, and a lack of motivation or interest in daily activities. People with hebephrenic schizophrenia may also experience hallucinations and delusions, although these are less prominent than in other subtypes of schizophrenia. Catatonic schizophrenia is a subtype of schizophrenia characterized by a range of motor abnormalities, such as immobility, rigidity, purposeless movements, and abnormal postures. People with catatonic schizophrenia may also exhibit echolalia, repeating others' words, or echopraxia, imitating others' movements. In addition to these motor symptoms, people with catatonic schizophrenia may experience other symptoms of schizophrenia, such as delusions, hallucinations, disordered thinking and speech, and flat or inappropriate affect. Treatment for catatonic schizophrenia typically involves a combination of antipsychotic medications and therapy, such as cognitive behavioral therapy or occupational therapy, to help individuals manage their symptoms and improve their functioning. In some cases, electroconvulsive therapy, ECT, may also be used as a treatment option for catatonic schizophrenia, particularly if other treatments have been ineffective. Undifferentiated schizophrenia is a subtype of schizophrenia that is characterized by symptoms that do not fit clearly into one of the other subtypes. People with undifferentiated schizophrenia may experience a range of positive symptoms, such as delusions and hallucinations, as well as negative symptoms, such as flat affect and reduced motivation. The symptoms of undifferentiated schizophrenia may fluctuate over time, with periods of remission and relapse. However, the symptoms are typically severe enough to interfere with daily functioning, such as work or social activities. Treatment for undifferentiated schizophrenia typically involves a combination of antipsychotic medications and therapy, such as cognitive behavioral therapy or family therapy, to help individuals manage their symptoms and improve their functioning. The specific treatment approach may vary depending on the individual's symptoms and needs. Residual schizophrenia is a subtype of schizophrenia characterized by a history of previous schizophrenia symptoms but with a current absence of prominent positive symptoms, such as delusions or hallucinations. People with residual schizophrenia may still experience some negative symptoms, such as social withdrawal, reduced motivation, or flat affect. The diagnosis of residual schizophrenia is typically made when an individual has experienced at least one episode of schizophrenia in the past, but no longer meets the diagnostic criteria for active schizophrenia symptoms. However, residual symptoms may persist and interfere with daily functioning. Treatment for residual schizophrenia may involve ongoing monitoring and medication management to prevent relapse, as well as therapy to help individuals manage residual symptoms and improve their functioning. Simple schizophrenia is a subtype of schizophrenia that is characterized by a gradual onset and a chronic course of negative symptoms, such as social withdrawal, flattened affect, reduced motivation, and impaired cognitive functioning. People with simple schizophrenia may also exhibit eccentric behaviors or odd interests, but they do not experience prominent positive symptoms, such as delusions or hallucinations. The symptoms of simple schizophrenia typically develop slowly over time and may go unnoticed for years. However, the impact of the symptoms on daily functioning can be significant, with individuals experiencing difficulties with work, social relationships, and self-care. Treatment for simple schizophrenia may involve a combination of medication and therapy to help manage symptoms and improve functioning. Unspecified schizophrenia is a subtype of schizophrenia that is diagnosed when an individual meets some but not all of the diagnostic criteria for a specific subtype of schizophrenia. This subtype may be used when an individual has schizophrenia symptoms that are not clearly defined or do not fit into a specific subtype, or when there is insufficient information to make a more specific diagnosis. People with unspecified schizophrenia may experience a range of positive and negative symptoms, such as delusions, hallucinations, disordered thinking, social withdrawal, or flat affect. The specific symptoms may vary depending on the individual's presentation. Treatment for unspecified schizophrenia may involve a combination of medication and therapy to manage symptoms and improve functioning.